Welcome to this month's CNA in Service on Behavioral Health and Behavior Guidelines for Staff. Why would you have to contain or hold someone for their safety? The quick answer is you might not. If an individual is escalating, it is the responsibility of staff to actively attempt de-escalation. Crisis Prevention Institute, or CPI, training highlights the importance of staff knowing the tendencies of their individuals and to watch for any behavior change that might be a result of agitation. If individuals start to escalate, staff are to intervene in an effective manner to encourage calming through supportive methods like verbal de-escalation techniques. Maladaptive behaviors and last resort physical interventions. Maladaptive behaviors can present a danger to themselves or others, to property, or interfere with habilitation and inclusion in the community. The primary method used to eliminate maladaptive behaviors is known as positive techniques. However, some maladaptive behaviors may be so serious that they require an immediate intervention, but that intervention is always the least restrictive possible. Let's talk about the Human Rights Committee. There is a Human Rights Committee, or the HRC, that serves all individuals regarding any need for pre-medication, stabilization, or restraint necessary for any medical procedures. The Human Rights Committee reviews all behavior plans prior to their implementation and every 6 months to ensure their effectiveness. The HRT on each team has several members. They include an HRC chairperson, a parent representative, a facility staff person, and a community representative. Behavior plans. Residents that have maladaptive behaviors should have a behavior plan. The behavior plan in the QRG will tell you what calm is for that individual. For example, breathing normally, responsive to questions, compliant with simple requests, etc. The behavior plan tells you what precursors of the behavior to look for and how to react to that precursor. De-escalation is to always be used as the initial intervention. Personal holds or humane body wrap is removed when the individual becomes calm, and staff are to be in-serviced on behaviors and their interventions for the individuals in their care. Any personal holds or use of humane body wrap is considered last resort. De-escalation should always be attempted by staff in order to calm individuals. When individuals are assisted by staff with de-escalation, it establishes a habit or pattern of our individuals being able to better manage themselves. It allows our individuals to learn and practice alternative appropriate behaviors to aggression and self-injury. What is the QIDP? The QIDP is your Qualified Intellectual Disabilities Professional, and your supervisor on duty is your SOD. They can provide approval for last resort physical interventions and approval of personal holds or the use or extension of the humane body wrap. Your psych examiners function as the QIDP during Monday through Friday, 8 to 4:30 p.m. hours, along with other staff such as your RNs, physicians, program coordinators, and possibly other staff that meet the qualifications. Your shift coordinators and your supervisor on duty are responsible in the evenings, nights, and weekends. They can approve those personal holds and the use of the humane body wrap. Personal restraint. A personal restraint is the use of a children's control hold or other personal hold methods that restrict movement as taught in CPI. Personal holds are restricted to only 15 minutes per behavioral episode. De-escalation or the use of humane body wrap are the only option if the individual is still out of control after 15 minutes. Personal restraints can be part of an individual's behavior plan or may be used as an emergency restraint. Preventive behavioral interventions. Preventive behavioral interventions include special clothing or equipment whose primary purpose is to prevent or inhibit maladaptive or dangerous behaviors. For example, individuals with SIB, which is self-injurious behavior, may have a preventative intervention in place. Preventive behavioral interventions are developed by the interdisciplinary team and is described in the individual's behavior plan. Preventive behavioral interventions restricts normal functioning. The resident must be checked every 15 minutes and released when the resident's behavior plan dictates for normal functioning. Some plans may require different time frames for checks or releases depending upon the situation. Document the staff checks and time in and out on the specific preventive behavioral interventions form. Humane body wrap. If an individual is placed in the humane body wrap, staff must notify the nurse immediately. The nurse has 15 minutes to check the individual for injury or circulation issues. The nurse must perform 15-minute checks or as needed throughout the use of restraint. This must be documented unless there is another emergency occurring and which must be justified. All use of humane body wrap are time limited. Individuals cannot be in the humane body wrap more than 15 minutes without the QIDP or the designee's approval. When the individual is calm, the individual is released. Calm is defined in the behavior plan. Document all extensions on the restraint form. Use of the humane body wrap has maximum time limits depending upon whether the individual restrained is younger than 18 years, which is your child or adolescent years, or 18 and older, which is your adults. An individual behavior plan may require an even shorter maximum time limit than the maximum time allowed by law. Children and adolescents younger than 18 years old have a maximum time of 55 minutes in the humane body wrap with 15-minute extensions approved by your QIDP or designee and then released for at least 5 minutes for normal functioning. So remember, for children that equals 55 minutes in and 5 minutes out. Adults 18 years or older have a maximum time of 1 hour and 50 minutes or 110 minutes in the humane body wrap with 15-minute extensions approved by your QIDP or designee and then released for at least 10 minutes for normal functioning. So remember, for adults that equals 110 minutes in and 10 minutes out. The humane body wrap equipment consists of wrist cuffs, ankle wraps, and the humane body wrap. The humane body wrap is always used in conjunction with a floor mat and never used on a soft surface like a bed or sofa. Some points to consider when using the humane body wrap. De-escalation must be attempted by staff prior to any physical intervention unless the situation is unsafe for those involved. The individual must be in imminent danger to themselves or others to justify any physical intervention. A floor mat is always placed flat on the floor. The humane body wrap is laid onto the floor mat. The humane body wrap is open with the center back of the wrap flat on the floor mat. Secure the attached wrap Velcro to hold the wrap closed. Do not use leg or cuffs to keep the wrap closed. Roll the individual onto their side. Staff should position themselves behind the individual who remains on floor mat to support and keep the individual on their side. Environmental emergencies and drills. Residents must evacuate during emergencies and drills. Walking, personal holds, or transport wheelchair may be used to transport an individual to a safe area if the individual refuses to evacuate. If an individual is in the humane body wrap when an emergency occurs, they must be released to safely transport to the safe area. However, the wrap may be reapplied in the safe area if it's needed. Injuries of unknown causes. If a resident is injured using the humane body wrap or wrist cuffs, it cannot be used again until a supervisor or the QIDP has inspected it and approved its use. If a resident is injured in any way by a restraint, a marks card must be completed. If a resident has a seizure during utilization of a personal hold or in the humane body wrap, they must be immediately released and treated for the seizure. A seizure report must be completed. There are a few types of increased supervision. The first one is visual. You should maintain visual contact at all times with your resident. Then there is enhanced, which means you will maintain close proximity to that resident. A one-on-one, you will maintain close physical proximity, usually within arm's reach. When you're handing off supervision, you must have a verbal and written agreement before assigning supervision. Be sure to sign off on supervision before you leave the resident in the care of another staff person. These are just a few of the things that are not acceptable at Human Development Centers. The following list are not tolerated at CHDC. If you see any of these things, you should report them immediately to your supervisor. Corporal punishment is unacceptable and should be reported. Use of unauthorized containment devices or techniques should be reported. Letting other individuals assist in discipline should be reported. Secluding our individuals, for example, sending them to their room as discipline, should be reported. Denying visitation or communication with family should be reported. Denying sleep, shelter, bedding, food, drink, or bathroom should be reported. Any form of maltreatment or neglect should be reported. Inappropriate vocalizations, some examples of this could be verbally shaming, insulting, yelling, mocking, making threats, using dominance, bullying, or using fear tactics to cower down our residents should be reported. Prone or face down holds will not be used on our residents and should be reported. Rear takedowns or bear hugs are not acceptable practices and should be reported immediately. Also remember, you need to report any actual or suspected abuse or neglect to a supervisor immediately. Even if you're not sure, it still needs to be reported. Never leave a resident alone with someone who has or who might harm them. If you have to, physically or verbally intervene. Request additional assistance if it's necessary. You will be asked to provide written details over the phone and then provide a written statement. Thank you for completing this month's CNA training. Complete the test, following this presentation, and then turn it in to your supervisor for grading. All graded tests will need to be returned to staff development. Be sure to have this completed no later than November 30th. Thank you.